Good afternoon, everyone. I'm Mags Rogers. I'm the Executive Director with the Neurological Alliance of Ireland. I'd like to welcome you all to this online event for our campaign to highlight the need for a consultant neurologist for Bantry Hospital. The Neurological Alliance of Ireland is the national umbrella group for over 30 neurological charities. And the event today is part of our Patients Deserve Better campaign, which is calling for local neurology services in 5 regional hospitals throughout the country, including Bantry Hospital. I'm delighted to welcome our speakers this afternoon. We have Ruth O'Brien, a local person living with multiple sclerosis. She recently featured in the Irish Examiner on this issue. We have Professor Aisling Ryan, consultant neurologist in Cork University Hospital, and we have Dr. Olivia Dubuel, consultant physician currently in Bantry Hospital. Before I hand over to our speakers this afternoon, I just want to thank everyone who's registered for the event today. Also to the local TDs, councillors and their representatives, and I would encourage them just to use the chat to introduce themselves and let everyone know that they're here today. We are hoping to run through the speakers and finish up around 1:30, just to give people a little bit of their lunch break back. And just to let people know that we are recording the event today and the recording will be available on our website later this week. But I want to hand over now to our first speaker, Professor Aisling Ryan, consultant neurologist in Cork University Hospital. And she's going to start her session today just outlining the need for a local consultant neurology service for Bantry. So if I can hand over to you, Professor Ryan.
Thanks very much, Mags, and welcome to everybody who's joined in. We're delighted you could be with us. As Mags has said, I'm a consultant neurologist in Cork University Hospital, which is a tertiary referral centre for neuroscience. It's one of 2 tertiary referral centres in the country, the other being in Beaumont Hospital. So we have a very large neurology service here. As you'll hear a bit later from Dr. Dubuel, there is an existing neurology service being provided locally in Bantry Hospital, but Dr. Dubuel will be retiring shortly. So there is a significant cohort of patients in Bantry Hospital who are being excellently looked after, who are having access to neurology care, and soon they'll be left without a consultant to supervise their care. We don't have the ability or the facilities to take on that cohort, unfortunately, in Cork University Hospital. As most people know, we all have existing waiting lists and huge pressure on our services here already. So it would be extremely difficult to absorb the care of a large existing cohort of patients immediately into the Cork University Hospital. The second point I'd like to make is more of a general point in terms of the importance of providing regional access to care for patients with neurological conditions. It's quite a long journey from Bantry Hospital to Cork University Hospital. I can see on the diagram that you've included there, Mags, that it's 80 kilometres. It's an hour and 20 minutes on Google Maps, but the reality is it's at least an hour and a half. And if you factor in trying to park in Cork University Hospital and trying to get to an outpatient appointment, perhaps quite early in the morning, that requires a huge amount of time. Many of our patients have disability. They need to travel with somebody. They may or may not be able to drive themselves. They may or may not be able to access public transport because of their disability. And this adds more time, more stress, more pressure onto patients for accessing what is a routine neurology follow-up appointment in many cases. So we would strongly advocate for the continuation and preservation of a neurology service in the Bantry area for all of these reasons. Obviously, it'll be fantastic for patients to have local access to care, and we also know that the importance of equitable access and geographic access and timely access to care means patients get diagnosed sooner, they get treated sooner. And for most neurological conditions, early access to diagnosis and treatment means that we can, in many cases, prevent disability, reduce complications, and provide better quality of life for our patients. So for all of these reasons, we'd be hugely supportive of continuing the existing neurology service and indeed augmenting it for the patients in the Bantry area.
Professor Ryan, thank you for that. I think you've given a really good summary of the type of issues that people are facing. As you say, it's not just around the journey, it's also around the parking in Cork University Hospital, and just for the service for patients that are currently attending Bantry, that Cork doesn't really have the capacity with the current resources to be continuing that service. I want to move on now to Dr. Olivia Debule, who's currently providing a service in Bantry Hospital. Dr. Debule, if I could ask you to describe that service and also what is happening when you retire later this year.
Yeah, so just a quick introduction. I've been working in Bantry Hospital almost 30 years. As a physician, but I'm trained as a neurologist, and over the years I developed those clinics that I'm still doing now. So basically I run 4 sessions a week of neurology clinic, 2 sessions of general neurology, which is made of new patients and returning patients. And then I have a session of for Parkinson disease clinic, another session for multiple sclerosis clinic, and the last session is of neurophysiology nerve conduction study clinic. So it's certainly it's I mean my waiting list is increasing slowly. So at the moment I'm semi-retired. I'm only working the neurology sessions, and the waiting list is increasing slowly, but it's increasing. I intend to retire at the end of May, and somebody, hopefully, I'm talking to my colleague, Dr. Danny Costello, to continue to provide those cover for those clinics after I retire. There's only one thing, the neurophysiology clinic, I might continue with that myself, because it's going to be difficult to find somebody who can do that particular skill. A neurophysiologist to come here for one session a week, it doesn't make sense at the moment. So that's the plan for June on. Yeah. I can only emphasize again the benefit of having a clinic locally is that accessibility, the length of the journey to Cork, the carbon footprint, etc., etc. People that we see in neurology clinics have a disability, and it's much easier to get to Bantry than to get to Cork. So
and
that's...
We're talking about, Dr. Debule, we're talking about a significant catchment area. We're talking about West Cork, a lot of which is rural, a lot of which is long distances for people who would have to travel to Cork University Hospital.
Yeah. Yeah, indeed. I mean, there are people from the peninsulas, the Sheep's Head, Mizen, and Castletownbere. That's a very long journey to Cork there. But I also see people who are coming from Clonakilty or Bandon because they find it easier, and the GP find it easier to refer to me, maybe because the waiting list is better. So that's another aspect.
And I think Professor Ryan has made that point that, you know, while the aim won't be to leave anyone without a service, and we just want to reassure people on that when you step down with your well-deserved retirement, that it will be up to Cork University Hospital within the resources that they currently have. There's no additional resource. And that's why we're running this campaign, is to get that additional resource to have a consultant neurology service in Bantry Hospital. So there is a precedent. You are providing this service, and it really needs to be put on a sustainable footing. by appointing
Yes.
a consultant neurologist for
Absolutely.
Bantry.
Yeah.
Thank you very much. I want to bring in.
You're absolutely welcome.
Thank you. I want to bring in Ruth, a person living locally with multiple sclerosis. Ruth, I just want you to bring yourself in on the perspective of someone who's had to travel for a service and the difference it would make to you if there was a properly developed neurology service, sustainable neurology service in Bantry Hospital.
Okay, thank you, Mags. I suppose I was diagnosed first in 2015. Just to introduce myself, my name is Ruth O'Brien. I'm working locally in Bantry, and I was first diagnosed in December 2015. Initially, I've always attended CUH, and initially I was on a monthly dose of Tysabri, which meant traveling to Cork every month, and having to take either a half day or a day off. I suppose the big thing is work-life balance, and also dealing with fatigue and all the other different things that people don't realize people with MS may suffer from. I suppose I'm lucky working for an organization, large organization, which is Cork County Council. I'm lucky I get the time off to attend hospital appointments, etc. But I suppose not many people are as lucky or not as well facilitated. And if we had a service locally in Bantry, it might mean that somebody might, only have to take maybe a couple of hours off, or they might be able to return to work or be able to attend outside their working day. The other thing is geographically, we have to travel to Cork. You mentioned Dr. Deboul mentioned the peninsulas. There's the Beara, Mizen, Sheepshead Peninsula, and there's a huge cohort traveling to Cork for the various neurology services that are offered there. I suppose the other appointments that maybe you might just, or not necessarily just see a neurologist, there's other lead-in, or there's other associated hospital visits as well. And very often, they're also in Cork. So it just means that people suffering from fatigue, people who mightn't be able to drive themselves, they might need relatives or family members to take days off from hospital. The parking is a huge issue as well around CUH, the parking charges. And it's very different than you come to the likes of Bantry Hospital, which is a wonderful facility locally, very accessible. It's close to the town, and the parking is a lot better than and it's a lot more accessible for people with accessibility issues. I think I suppose now I'm on an infusion every 6 months. So I have to attend every 6 months now, just for the infusion. And again, it's like it's a day off. It's like 5 or 6 hours in the hospital, and then it's it's the tiredness afterwards and having to face a long journey. So I suppose that's what I wanted to like. And I understand that Dr. Deboul is providing wonderful service in Bantry, and we do need a dedicated neurology clinic in Bantry to continue and possibly expand. And I understand that CUH, CUH is a wonderful facility also, but I can understand that given staffing levels and waiting lists, that it won't be possible to cover when Dr. Deboul retires. So I suppose that's just what I wanted to highlight today.
Thank you so much, Ruth, and you've given a very powerful testimony there of just the rational reason for having this service continuing, as you say, for your own experience on so many people like you traveling long distances over a long period of time. This is not just for a 6-month period or a 1-year period. These are lifelong conditions. These are people traveling for a number of years to their neurology service, and and there's as I say, with an existing service in Bantry Hospital that would be continued. Professor Ryan, I'm just conscious that you were speaking at the start, and we had some people join in. They might have missed just the beginning of your talk. Could I just revisit with you just around the support that there would be in the neurology service in CUH for this service in Bantry to continue? That this is not just the Neurological Alliance saying that there should be a neurologist, that this is very much a service that's in place at the moment and should be continued and developed.
Absolutely. Thanks, Mags. And Obviously, you know, Dr. DeWiel has been there performing, you know, delivering a fantastic service for many years. And of course, we've been aware of his, you know, plans for retirement for several years. And this is something we've been advocating for many years, in fact. And now I suppose this has come to the crunch when he is due his well-deserved retirement. But we very much value the service that has been developed, that has been built, that is functioning really well for the people of Bantry and the surrounding area. And the post we're advocating for, of course, will be providing a service to the Bantry region, but will be linked to the Tertiary Neuroscience Centre here in Cork University Hospital. So the person providing the service in Bantry will have all access to all the expertise and to the facilities, etc., if needed in Cork University Hospital. But what we're really strongly advocating for is delivery of service close to home, timely access for patients who live very far away from the hospital, who, for many reasons, for reasons of disability and very practical reasons, find it extremely difficult to come to Cork University Hospital because of the distance, because of their disability, for many different reasons. And we really strongly endorse the continuation of the service that's been established, the formalisation of an existing neurology service in Bantry, and all of that would be strongly supported by the group here in CUH.
Thank you so much for that. And I'll reiterate that message. We have an existing service in Bantry Hospital. We have an existing neurological service, tried and tested. And really this campaign, we're urging people to support this campaign, to continue that service, to continue and develop that service for patients locally, put it on a sustainable footing, as both Dr. DeWiel, Ruth and Professor Ryan have said this afternoon. I'd like to thank everyone, particularly our speakers this afternoon, for their powerful messages and their powerful testimony. We will be continuing this campaign right up to the budget. Our budget ask is for 5 consultant neurologists for 5 regional hospitals around the country. Bantry is one of those hospitals. I would ask people to visit our campaign website, patientsdeservebetter.ie, to contact their local TDs directly in support of the campaign. But we will be continuing this campaign, as I say, right up to budget. So thank you everyone for joining us this afternoon. And also to thank the 23 neurological organisations that are supporting the Neurological Alliance in this campaign. Thank you to all our speakers, thank you to all our attendees, and anything that you can do over the coming weeks and months in support of this campaign to protect the existing neurology service in Bantry Hospital for patients. Thank you.
Thank you.
Thank you, Ruth.
Thank you.
Thank you, everyone.
Thank you for your support.